holiday season is fast approaching and most of us are planning to travel, especially overseas.
The doctors of the Indian Medical Association of Queensland have got to get together to give you some tips so that you can have a healthy travel. We have started our planning, and the first question is, what is required?
Let's ask Dr. Snya Chaddha about the requirements of what vaccines we need, especially to India.
People going to India to visit family or friends are at high risk of certain infections. I would say a bit more than a simple business visitor who stays in a hotel and comes back without closely interacting with the local population much. Visiting family and friends is more at risk due to the amount of exposure with, for example, a domestic helper who comes to do daily cleaning and kitchen work in your home and gets you exposed to the infections which they bring from their household whilst appearing well, because they may have immunity to these infections due to repeated past exposures. The good news is that many of these infections are vaccine preventable. Vaccines are accessible in Australia for hepatitis A and B, the diseases affecting liver and causing jaundice, typhoid, tuberculosis, cholera. Serious infections prevalent in India which can have fatal outcomes are meningococcal, Japanese encephalitis, and rabies. All the three mentioned diseases have vaccines available in Australia. Many of the respiratory diseases like influenza, COVID, pneumococcal, measles, mumps, rubella can be prevented through good hygiene measures and vaccinations easily available in Australia. Malaria and dengue fever, which are prevalent almost throughout the year in India, unfortunately do not have a vaccine program. Hence, mosquito bite prevention is the key to prevent them. Wearing long sleeves and using mosquito repellents is very important. Prophylactic anti-malarial tablets can be used for malaria prevention, but they have to be taken before leaving, throughout the stay overseas, and for a few weeks after returning back to Australia. I would emphasize that malaria infection could be deadly to a previously non-exposed person traveling from Australia. But at the same time, it may be just a mild illness to a local person living in India with multiple exposures in past. All vaccines except BCG can be administered through GP practices routinely. BCG vaccination for tuberculosis can be booked through PA hospital on case basis. I wish you all a safe journey to meet your family. Dr. Snya Chaddha, Clinical Director, Chimbumba Pharmacy Medical Center. Thank you.
Documents are very important, including travel insurance. Always check Smart Traveller website for each country you visit.
Dr. Feroz Ameerjan, General Practitioner and Designated Aviation Medical Advisor, will tell us more.
Good day everyone, I'm Dr. Feroz Ameerjan. I'm a General Practitioner and Aviation Medical Specialist based in Brisbane. Along with General Practice, I also work for the Australian Defence Force as a Senior Aviation Medical Officer. My topic of discussion today is about travel vaccines and travel insurance as we are heading towards the peak travel time during Christmas and New Year holidays. There are three important steps to this. The first step, when you decide to travel, please talk to your doctor about your travel plans. This allows your doctor to update your routine vaccines, either it is influenza or tetanus or COVID-19 vaccines. And depending on your destination, your doctor can advise you on specific travel required vaccines. This is really important because it needs to be planned and it needs some time to be delivered. You can also look at the CDC website, which is the Centers of Disease Control and Prevention, and look at the specific advice for certain destinations. The second step is to look at travel insurance. Now, many people have spent a lot of money for them to be medically repatriated back due to unexpected illnesses or injuries. So please make sure that you do have a good travel insurance cover. At the same time, it is also important to look if you have COVID-19 cover, given the situation around the world. And finally, the third step is to look at the Australian government's Smart Traveller website, which has quite a lot of important information, not just about travel, also they give specific advice on safety and security and how to reach out for their consular services. You can also set up email alerts to your travel-specific destinations. With that, I would like to thank you and wish you a very safe travel.
Being prepared is half the job done. Everyone should carry a first aid kit.
Dr. Siddhartha Sarma will tell us what medications and items to carry along.
Start.
Good evening, ladies and gentlemen. I'm Dr. Sid Sharma. I'm a GP in Ormo, and today I'm going to talk about common things to take with you on your travel to India. Firstly, it's very important that if you have a chronic medical condition, it's really important to take your prescription medications with you. For example, if you're diabetic, if you've got asthma, make sure you take your anti-diabetic medications. Make sure you take your inhalers with you. If you've got a condition like anaphylaxis, please make sure that you carry your EpiPen with you. It can be required at any time. And getting access to medical supplies might not be as easy as you think. Vaccinations, extremely important part of the journey, because journeys at the best of times can be very stressful. So please make sure that you're up to date with your vaccinations. COVID is again around the corner, so please make sure you're up to date with your COVID vaccinations and follow the general rules of sanitation, like washing of your hands, so on and so forth. Prevention is always better than cure. India does have a few malaria-prone areas, and there's a little bit of dengue going around at the moment, so please make sure that you carry your mosquito repellents, because the best way to protect yourself against things like dengue is to make sure you don't get bitten by mosquitoes. It is also important to talk to your GP about anti-malarial prophylaxis if you go to a malarial endemic zone, and there's quite a few of them in India. Please acquaint yourself to the zones where you're traveling to, and the malarial medications might need to be started before you leave the country for them to be effective. It's also important to carry things like water purification tablets, because there's a lot of waterborne diseases that you really want to avoid on your journey, as they can give you a really upset tummy, vomiting and diarrhea, so on and so forth. So water purification tablets, please make sure that you drink water from a reputable, good source, and avoid at all costs any unwashed vegetables or uncooked meat or unpasteurized milk. And this is especially important for pregnant women and for children as well. Common medications to take with you on your journey, things for pain, for fever like paracetamol, Nurofen for adults as well as for children, antihistamines like Claritine or Zyrtec. If you're allergic to anything, your asthma pumps definitely. Make sure you carry your anti-diabetic medications, as I mentioned previously, your EpiPen and your inhalers. In short, if you have any doubt as to what you need to carry on your journey, please refer to the Center of Communicable Diseases website, which you can get on Google easily, and speak to your GP, who will be your best source of contact. Have a great, happy and healthy new year, and wishing you and your family a great time in India. Bye.
A lot, but they have to be looked after even more.
Dr. Upasana Kapoor, pediatrician from Brisbane, will tell us more about it.
Hello everyone, I'm Dr. Upasana Kapoor and I'm a pediatrician. As you all know, we're heading into the holiday season, and I'm sure a lot of you have got trips planned. So I'm going to just share a few tips and tricks to make your journey more pleasurable when you're traveling with children. So one of the things that I think is really important is to talk to your children about the holiday, about the travel, before you actually take the travel. It's important to brief them about, what to expect at the airports. There are going to be crowds, there's going to be security check, how long your journey is going to be, whether there are going to be breaks in the journey, and which destinations you would be going to. I think if children know what to expect, they're likely to be better behaved and hence a more pleasurable journey for you. Um, Also, if you can work around, things like timing your travel, seating arrangements, looking at whether there are child-friendly toilets, feeding rooms, all of those things would be helpful to know, because then you can plan accordingly. And while you're packing for your trip, don't forget to involve your children with the packing process. That will not only give you some help, but will also make your children more interested and excited for the travel. I think this is also a beautiful opportunity for you to bond with your children. And the other thing, one more thing that I want to emphasize on is, don't forget to carry healthy snacks with you. Things like nuts, yogurts, muesli bars are all healthy snacks that you can carry. And if you have healthy stuff around, then children are less likely to gravitate towards unhealthy foods. And make sure you've got plenty of books, toys, puzzles, other things to keep them entertained, because sometimes the journeys can be long and boring for the children. And again, this is another beautiful opportunity for you to bond with your children. So I wish you all a very happy holiday season, and I hope you have wonderful moments with your children and make beautiful memories. Thank you.
Pregnant women need special care and advice during travel. For more information, let's come to my office and to discuss about this. And today I'll be talking about safe travel during pregnancy. Pregnancy is a very exciting time where many women want to travel, particularly overseas, to see their family and friends. So we've got to do this safely. The safest time to travel in pregnancy is in the second trimester, which is between 13 weeks and 26 weeks of gestation. High-risk pregnancies, for example, pregnancies with gestational diabetes, preeclampsia, high blood pressure, and multiple pregnancies, these are the ones where long-haul air flights and prolonged travel is best avoided. Pregnancy poses an inherently increased risk of developing blood clots. Hence, it's important to discuss with your regular doctor and check your individual risk factors, whether you need any blood thinners for the duration of your flight or throughout the pregnancy. Vaccinations are very important in pregnancy, particularly COVID-19 vaccination and influenza vaccination, which these vaccinations are considered safe in pregnancy. Lastly, some practical advice about checking with your airlines what their rules and regulations are about travel. Some airlines don't allow women to travel beyond 35 weeks gestation. It's also very important to check the country where you're going to, what medical facilities they have, in case you need any medical facilities. With that, I conclude my advice on safe travel during pregnancy. Have a safe journey. Now we have Dr. Yogesh Āpté with us. He will be discussing management of in-flight emergencies with us.
Hi there. So, you're about to fly and want some tips on how to manage a medical emergency in flight? Hello, my name is Dr. Yogesh Āpté, and I'm a senior ICU specialist with Queensland Health. I'm no expert aeromedic, but have enough experience in both flying as a passenger and managing emergencies as a doctor. So here I am, sharing some important aspects of an in-flight medical emergency management. The estimated prevalence of in-flight medical emergencies is 1 in 600 flights. Other estimates state that in-flight emergencies vary from 24 to 130 per million passengers. Given that over 4 billion annual travelers, it is likely that 260 to 1420 events occur daily worldwide. In-flight medical emergencies are unique events for which traveling medicos may be required to provide assistance. You are at an altitude of over 30,000 feet. You have a pressurized cabin with low oxygen and humidity. There is limited medical equipment available, and proper healthcare may be hours away. You have people of all ages and different medical conditions on board. All airlines have emergency medical kits on board, but they vary with each one. Generally, the list of equipment may include automated external defibrillators, protective gloves, stethoscope, blood pressure apparatus, oxygen saturation monitors, IV access and IV fluids, antiemetic, analgesics, hypoglycemia management, including intravenous glucose, aspirin, nitroglycerin, and anaphylaxis management. Oxygen bottles are available which deliver oxygen at low 2 liters per minute or high 4 liters per minute settings. Number of oxygen bottles vary and generally not enough to help manage somebody with persistent respiratory failure. Role of medical volunteers, that is a doctor or nurse on board. You do not need a proof of your medical license. One must honestly consider their own abilities to be able to provide medical assistance in an emergency. More importantly, you must not be under the influence of alcohol. If there are more than one medicos, then talk to each other along with the staff in the flight and manage with consensus. What is the role of the medical volunteers? The primary role is to assess the patient, aid with communicating with the ground staff if required, help with administering medications, although the final call will rest with the ground staff, provide ongoing care as required until destination is reached. Multiple national and international laws exist to protect the medical volunteer for their services during an in-flight emergency. Medical assistance by a naval practitioner is of little personal or professional legal risk and is well supported internationally. Let us look at a few common medical in-flight emergencies that you may encounter. I'll start from the commonest to the least common. So syncope or near syncope. About 30% of in-flight emergencies you will encounter syncope. Important to distinguish varieties of causes of syncope, including vasovagal, cardiac, pulmonary, stroke, or hypoglycemia. If the patient is unconscious, important to lie them on the floor of the aircraft, elevate the legs, provide oxygen if required, check the vitals. If there is no pulse or no signs of life, then follow the cardiac arrest algorithm, which I'll talk to you later. If this is a transient syncope, lying flat with leg elevation generally should resolve symptoms. If nausea is absent, that is a good sign. If nausea is present, you may have to consider antiemetic. Slowly sit the patient up and return to the seat as tolerated. If patient is hypoglycemic on glucometer check, provide glucose orally or intravenously. If there are any other conditions evolving from syncope or near syncope, you may have to follow subsequent management. If patient is not improving, contact ground staff. That goes to say needless. For gastrointestinal illnesses, it's about 15% of emergencies. Initial assessment should be extent, timing of symptoms, including nausea, vomiting, diarrhea, bleeding, and any specifics of abdominal pain, location, quality, severity, etc. Simple management and expected course would be if patient just is nausea or is vomiting, oral antiemetic will be available and should be administered. If not tolerated, then consider a parenteral antiemetic. Important to continue providing oral hydration as tolerated or intravenous if not tolerated. Sugar-containing liquids should be provided if there is hypoglycemia. If there is presence of dyspepsia, consider an antacid. If patient has diarrhea and is associated with fever and is longer duration than just the flight, then contact local health authorities for appropriate precautions. For any signs suggestive of severe abdominal pain, tenderness on examination, rigidity, definitely contact ground staff because this might be a surgical emergency. For any respiratory distress on flight, happens about 10% of all in-flight emergencies. Identify history of respiratory disease, the duration, previous extremity swelling, and any other medical conditions, including patient's own oxygen if they are on any. Check vitals, check pulse oximetry. If the oxygen saturation is less than 95% and their baseline oxygen saturations are normal, then consider providing oxygen. Remember that oxygen of 4 liters per minute, you will not be able to provide for long, so you have to be careful. Monitor ongoing all other vitals.
So much to do, stress and anxiety while traveling. Let's see how we can reduce it.
Let's ask Dr. Hemant Khanna about some advice on this.
Today we'll be talking about travel anxiety. Anxiety is an entirely normal part of the human experience. In particular, after an extended gap and restrictions on overseas travel, it would be normal to experience a sense of trepidation before heading overseas. Hopefully, these 5 points are of some benefit to you. Firstly, please be open with your friends and family. It is normal to experience a sense of stress leading up to some time away. So there's no benefit in forcing yourself outside of your comfort zone. The key would be to build confidence by planning, preparing, and ideally to prevent. The key thing is having adequate insurance cover, in particular if you're partaking in any risk-take or adventure activities. It would be worthwhile considering to also minimize or ideally avoid alcohol intake, in particular on long-haul flights. If possible, 3 to 5 days prior, try and adjust your sleep cycle to the time zone and give yourself enough time to recover upon landing. There will be some element of uncertainty, and you can anticipate that. Might be worthwhile considering and planning for the worst, hoping for the best. In that setting, a lot of these things are outside our locus of control. Last-minute cancellations, delays, and in particular, if you have international stopovers, give yourself enough time, ideally 6 to 12 hours, to create a bit of a buffer zone for any delays in landing and departure. And lastly, wish you all the very best for your holiday. Focus on the fun stuff. And my name is Dr. Hemant Khanna. Have a safe flight.
Last but not least, people with chronic health conditions have to look after themselves more. Let's ask Dr. Shunil Sharma to throw some light on that.
Good evening. My name is Shunil Sharma. I'm a specialist physician and a rheumatologist practicing out of Gold Coast Private Hospital in Southport. I've been asked to give you some general advice regarding travel. I think the first thing with travel is that you have to prepare well, particularly with the vaccination certificates and look at the requirements of the country that you're going into. And in view of the fact that now COVID is quite rampant in many places, ensure that you are you're completely vaccinated for that. But there will be certain special requirements in different countries, like yellow fever vaccines, etc. So you need to talk to your GP, who will be the center person giving you all the information as to where you're going and what you need to do. You should also have a letter of introduction if you have a lot of chronic problems, particularly if you're on a lot of medications, and that will give an introduction should you have the misfortune to be ill in a foreign country. That is very, very important. Also, I think you should register with smarttraveler.com rather, and that should help in case if there's any issues whilst there. So I think the important thing is to ensure you ensure what you need, and to keep all your medicines with you in the hand luggage, or at least a 1 week supply of it in case if your luggage gets lost. And I hope you have a good travel season, and wish you all the best. Thank you very much.
Whoa, that was a lot of information on travel.
Yes, that was indeed. On behalf of the Indian Medical Association of Queensland, I thank all the doctors who have contributed to this. Wishing everyone a Happy New Year and safe travels.